to the Garden Years. I'm your host, Gloria, and I'm here every week for women who refuse to let age define their limits. Today, we're diving into something important, and I promise to keep it real, keep it warm, and keep it moving. I want to offer this disclaimer first. It's a quick disclaimer before we get started. I am not a medical professional, so please take what resonates and leave what doesn't. And always loop in your doctor before making any health decisions. What I am is a woman who has done her homework and who cares deeply about your well-being. That part is fully qualified. In my launch video, you heard how I fell in the garden and tore a ligament. It was embarrassing and painful, but I moved on to a better place. But since January of this year, 2026, I've heard of at least 10 falls among my family and friends. I don't share this information to illuminate their situation, but to help us plan ahead and not move in fear and caring for our own minds and bodies, and for caring for our loved ones. Now let me unpack what planning ahead actually looks like, because I think we sometimes make it more complicated than it needs to be. There are some contributing factors. When I talk about the factors that contribute to falls, I want us to look at this honestly and without shame. Age itself changes our balance, our reaction time, our bone density. The physical condition of our bodies matters. Muscle strength, flexibility, core stability, and yes, even our foot health. Are we wearing the right shoes? Are we paying attention to how we walk? Vision is another factor. We overlook, when did you last have your eyes checked? Depth perception. Depth perception change as we age, and that matters more than we realize when we're navigating steps or uneven ground. Our mental and emotional health plays a bigger role than you ever would think. Anxiety, depression, and even grief can affect how steadily we move through the world. When our minds are overwhelmed, our bodies follow. Then there are medications. Yes, medication. And this one surprises people. Many common prescriptions, including blood pressure medications, sleep aids, antidepressants, and antihistamines, can cause dizziness. Sometimes we don't even know what dizziness feels like. They cause us lightheadedness, or they affect our coordination. If you are on multiple medications, this risk compounds. Please talk to your doctor about this. Some of us are managing a whole pharmacy in our medicine cabinets. No judgment. I see you. But it's worth knowing what all those little pills are doing together. And finally, our physical environments, the rugs, the lighting, the stairs, the clutter we've learned to step around without even thinking about it. The bathroom, the garage, the back porch at dusk. These spaces deserve a fresh set of eyes. There are a few more factors worth naming. Chronic conditions like arthritis, Parkinson's disease, diabetes, and osteoporosis all affect stability and fall risk in different ways. Arthritis can limit joint flexibility and cause pain that changes how we walk. Diabetes can cause peripheral neuropathy, numbness in the feet, which literally affects our ability to feel the ground beneath us. These are not rare conditions among women our age. They are common and they deserve our attention. Hearing loss is another one that's overlooked. Our inner ear is deeply connected to our sense of balance. When hearing declines, spatial awareness can decline with it. If you've been putting off that hearing evaluation, this is your nudge. Dehydration and poor nutrition affect us more than we realize. Low blood pressure from not drinking enough water. That can cause dizziness, especially when we stand up too quickly. What doctors call orthostatic hypotension, and low levels of vitamin D, which is extremely common in women our age. And because our bones get weak and so does our muscles. Finally, let's talk about sleep. When we are tired, our reaction time slows, our concentration fades, and our bodies simply do not respond as quickly as they should. Fatigue is a fall risk. Rest is not laziness. It is part of our protection plan. None of these factors are a life sentence. They are simply information, and information is power. What can we do about it? So, what does talking positive action actually look like? I want to invite you into this, not overwhelm you with a to-do list, but open a door and say, walk through it with me. It starts with movement, strength training, balance exercise, yoga, Tai Chi. These are not optional luxuries for women our age. They are protective medicine. Research consistently shows that building leg strength and improving balance significantly reduces fall risk. You don't need a gym. You may need some YouTube to look at for exercise. You need consistency. It means having honest conversations with your doctor about every medication you're taking and asking directly, could any of these affect my balance or my coordination? Don't assume they'll bring it up. You bring it up. It means getting your vision checked and making sure your prescriptions are current. It means paying attention to your footwear. Supportive, well-fitting shoes with non-slip soles are not a fashion compromise. They are a safety decision. It means walking through your home with a new eyes. Remove those throw rugs or secure them. Add grab bars in the bathroom. Make sure every staircase has a solid handrail. Improve your lighting, especially in the hallways and at night. Keep pathways clear. It means staying hydrated because dehydration affects blood pressure and coordination more than most of us know. Get a falls risk assessment. Many primary care physicians and physical therapists offer these. It's a simple evaluation of your strength. It's a simple evaluation of your balance and your gait that can identify vulnerabilities before they become problems. Ask for one at your next appointment. Consider working with a physical therapist even if you haven't been injured. A good physical therapist can design a program specifically for your body, your conditions, and your environment. This is not rehabilitation. This is prevention. Address your bone health. Talk to your doctor. Talk to your doctor about your bone density. If you haven't had a DEXA scan, DEXA scan, ask about it. Osteoporosis is called the silent disease because you don't know you have it until something breaks. Calcium, vitamin D, and weight-bearing exercises all matter here. Pay attention to how you rise. Standing up too quickly from a bed or chair is one of the most common triggers for dizziness and falls. There is no reward for leaping out of bed like you're 30. None. Pause and breathe. Let your body catch up with your ambition. Stay socially connected. This one might surprise you, but isolation contributes to depression and cognitive decline, both of which increase fall risk. Women who are engaged, active, and connected move through the world with more confidence and awareness. And finally, tell someone. If you had a near fall, a dizzy spell, or a moment where your balance felt off, don't keep it to yourself. Tell your doctor. Tell a family member. Tell a friend. These are not embarrassing admissions. They are important data points that could prevent something serious from happening in the future. Strong women plan ahead. They don't ignore the signals, they act on them. And every week we have an invitation. So here's my invitation to you this week. Pick just one thing from today's conversation and do it. Just one. Check your medications with your doctor, or move one rug, or schedule that vision appointment. One thing done is better than 10 things planned. Thank you for spending this time with me. You showed up for yourself just by listening, and that matters. Keep growing, keep going, and don't forget, your best season is still coming. See you next week in the garden years. Bye.